but not specific to football. Aaron, you talked about football, but Daryl, maybe you can talk broadly about how our student athletes and our coaches and our programs are interacting with each other during this time.
I think it's, again, not specific to football. All of our coaches, all of our teams are interacting differently. But I would say we've taken a 360-degree approach, meaning that everybody associated with that team is making sure that the student athletes have everything they need and are okay, meaning that the coaches are reaching out, the athletic trainers are reaching out, dietitians are reaching out, counselors are reaching out, strength coaches are reaching out, and we're doing a very good job of communicating with the student athletes. And then everything else goes on a team-by-team basis. Some coaches have sent film remotely with their iPads. Some coaches check in via FaceTime. Pretty much all of our strength coaches have been working diligently to send home exercise programs to their student athletes. The dietitians have been working to send meal plans and recipes and different ways that they can grocery shop and, doing FaceTime things while they're at the grocery store to help them pick out things or help them read labels. Our counselors check in with their patient population regularly, and then if anything else comes up, we have a whole communication network and flow sheet that goes through that who needs to get contacted, and those people will contact the student athlete to provide that crisis intervention right away. Our academic counselors are obviously checking in from the academic side. So it's a very 360-degree approach to everybody communicating with the student athlete and making sure all their needs are met, whether or not they're in Ann Arbor or they're home at their home location across the globe.
Really good insight. Thank you. Aaron, finishing off that question, had a question, when can we expect teams to resume their spring activities? For everybody on the webinar, all competitions, all practices have officially been canceled through April 21st, and anything after that will be decided upon in the future. So right now, April 21 is the date that's on the books. This one for Abigail, this is from Dan. Abigail, can you speak more about state restrictions you mentioned that limit the help you're able to provide? Are there categories or types of help you're restricted from providing at a distance? And are you working with other universities or athletic departments in those states in order to maybe help provide solutions or facilitate coverage?
Yeah, so we're all independently licensed in our various states. So for example, my clinical license is solely in the state of Michigan. Because I've been practicing for well over 5 years, I do have reciprocity in other states should I want to apply for licensure in those states, but that does take time. When things were declared a national emergency, there is some leniency. Like for example, HIPAA regulations were suspended. So it offered an opportunity not to just engage with the encrypted voice and video conferencing that we utilize at Michigan, but other modes and means of communication. We haven't done that. We've stuck into utilizing BlueJeans because it is the easiest thing to ensure that we're still maintaining HIPAA. But because practicing across state lines, we can't do that for psychotherapy at this time. We've really leaned on our professional organizations, the National Association of Social Work, the APA and beyond, to really bring that to the forefront to offer some leniency so that we can start doing that. What we've done through our Big Sky community and also through the Big 10 mental health providers is we've generated a list of over 300 providers across the country and across the world. Should an athlete need to be seen face-to-face and we're not able to do the psychotherapy with them at that time. So yeah, we've been communicating and coordinating with one another to help resolve those solutions. What we've noticed thus far is that because our student athletes are still transitioning to this new and hopefully temporary reality for this period of time, that offering support by phone and check-in currently has been enough, but we do have measures in place should they need face-to-face counseling or more immediate crisis response.
And Kurt, the same issues come up in the field of dietetics as well. Many states have licensure and the same state-to-state rules apply. So while my staff and we can provide support and contact across state lines, but if I'm not licensed in the state of California or Florida or New Jersey, providing nutrition counseling is against those states' licensure. So again, tapping into our broad network of colleagues around the country, if we needed to provide something above and beyond support kind of in this transition in a temporary time, is okay, but beyond that, we really want to also be aligned with those state laws.